Hello and good evening, everybody. Thank you for joining us today. I'm Dr. Gauri and I welcome you all from the Brainchild Trust. And I now hand over to Bindia without any delays to start off the session. Thank you.
Thank you, ma'am. Good evening, everyone. Welcome to the third academic webinar by Brainchild Trust. Today's webinar is about family well-being, focusing on child-centered and family-focused therapy practices for children with disability. Our honorable speaker today is Dr. Kirtika Rajaraman, who is presently Consultant Developmental Pediatrician and Associative Director in CCTD and Motherhood. Very glad to have you today, ma'am. Over to you.
Hi, good evening, everyone. Thank you for the nice introduction, Bindya. So, without any further introduction or talk, I'm going into the slide. Apurva, can you share the slide, please? So, today's topic is child-centered and family-focused therapy services. It's not for a particular, I'm not addressing particular disability. It's for all different kinds of special needs. Might be few videos can be with respect to autism spectrum disorder, but the topic which is being talked today is can be considered for the general population with special needs. Apurva, can you go to slideshow mode? Okay, so next slide, please. So the question I'm trying to ask you, and at the end of the presentation, if all of us can answer these two questions correctly, then we have got the takeaway points of the presentation of today. For whom our services are offered. Like we all know, like when we are offering services for children with special needs, are we offering our services only to children with special needs or to the family with the child? And who is taking the decision? Like we have multiple decision for what type of assessments need to be done for the child, what type of goals we need to set for the child, what type of therapies should be provided for the child, who will take care of the well-being of the family, who will take care of the well-being of the sibling. So who takes this decision? Whether the multidisciplinary team of experts or the family who knows the child very well, or it is together. So these are the questions which I'm putting forth. And at the end of the presentation, together we are trying to answer this question. Apurva, click on, please. So I think already people have started answering for whom our services offered. I saw an answer like family with a child. Yes. Let's look into it. If it is family with a child, why it is family with a child? If the decision is taken by the service providers or the family or together, let's go through the presentation and get to know. Any child, whether it's neurotypical or child with special needs, a child is a part of a family unit. A child cannot be seen separately. It's a part of a family unit. And each and every family is different and unique. Might be if we just get to think about different families, we provide services. We have seen families from, and might be from a joint family. We have seen families from nuclear family, and we have seen families who are like really very supportive to each other. We have also seen like there is a lot of conflicts between the parents themselves and the extended family, adding much more conflicts. It could be a family of a single parent family. It could be family of like well-read parents, well-read grandparents, that being the support, or it could be the other way around, well-read parents, but they are causing a lot more problems. So every family is different and unique in its own way. And family is going to be the constant in child's life. The diagnosis of the child can change over time. The services they take can change over time. The therapist can change over time. The doctor can change over time. Who will not change over time in child's life is the family. The family is going to be the constant. They are the experts on child's abilities and needs. Sometimes they might overestimate the abilities or they overestimate the child's difficulties, but practically or logically speaking, they are with the child for a longer period of time. So obviously, they know more about the child's abilities and needs. And whatever it is, they want the best for their child. Now, thinking from our childhood, how many of you have been scolded by your parents? How many of you have been spanked by your parents? If I have to rise, I would certainly raise my hands. It is not that our parents scolded us, spanked us, thinking like, oh, it's going to cause a physical abuse, emotional abuse. No. At that point of time, they considered that to be the best thing they can do, and they did. So later it can be reflected in any way or the other, but any family, any parent, whatever they are trying to do at this point of time is what they best know, and it is with the best intention. And an optimal child functioning can occur within a supportive family. So we all know that if the family is going to be supportive, then the child's functioning is going to be the best. Whatever the therapy services, best of therapy services, if it is available to the child, but if the child is not in a supportive environment, then the change which is going to occur in the child might not be optimal. And it is not only that, the child is also affected by the stress and the coping of his or her family members. So, with this point in mind, we know for sure a child is a part of a family unit. So, we can't provide services for the child alone. If we try to provide services for the child alone, we can't be successful. Next slide, please. Now, moving on to the next add on point, there is a beautiful model called transactional model. Development of any child, whether it's neurotypical or child with special needs, is a product of a continuous dynamic interaction of the child and the experience provided by his or her social setting. When it comes to social setting, the immediate social setting of any child is a parent, followed by the extended family members, followed by the community. It could be the closest relatives, neighbors, friends, and the geopolitical society. And in a child's life, a very important role is played by the school and the peers. Now, when it comes to child with special needs, in the place of school, our multidisciplinary team comes in: doctors, physiotherapists, speech therapists, behavior therapists, psychologists, counselors, all of us come into that school thing. So by looking at this transactional model itself, we can't provide our services only to the child. We are going to provide our services, a child being the part of the family. Then only we can create this continuous dynamic change in the child's life. Next slide, please. So for any child, first as they come to us, we are going to do assessment. So what is assessment? Are we trying to judge the child's strengths, child deficits, or are we trying to understand? If I ask this question, I want you people to put in the chat box, what do you think? What are we trying to do by assessment? Are we trying to judge or are we trying to understand? If it is child's inherent characteristics, inherent strengths of the child, and we also try to see like how much is a child's strengths to learn new concept. When I'm saying strengths to learn new concepts, we are trying to see like, is a prerequisite skills present or not? If it is not present, in which area it's present, in which area it's not present. Yes, there are many things coming up in the chat, like we are trying to understand. Now, the next one, the assessment doesn't stop there. It goes with parents' inherent characteristics. Might be most of you, as you are assessing the child, meeting the child for the first time, you will also get to know about the parents. You will get to know the strengths of the parents, deficits of the parents. How are they trying to learn? How are they trying to deny what you say? Now, I want you to ask the same question again. Are you trying to understand the parents or are you trying to judge the parents? So if we are being true to ourselves, somewhere or the other, if we say again understanding, it's not the truth. Somewhere or the other, judging comes because we are all human. So we tend to judge, but are we aware that we are judging them? if we are aware that we are judging them, then we will also be aware that the other person, the parent and the family is judging us. So one thing is, it's a thing of judging which is happening, but are we aware of that and moving to an understanding space? Next, please. The next one, in the assessment, we should be very sure that doesn't starts with child's characteristics and parent characteristics. Are we getting to know about the parental well-being? So might be the first visit we might not get to know, but as we are with the family, then the parents try to share and we try to understand their world better. How much supportive their family is, what is the mom's strength, how is she trying to cope, all that we try to understand. So when it comes to assessment, it is not that we are dealing with the child, we are dealing with the parents and their well-being too. Next slide, please. So now we are very clear that when it comes to whom we are providing services, we can't provide services only to the child. We are providing services to a child within that family. So now moving on, you have all assessed the child. As a team, we have assessed the child. Now we have to set the goal. Then only we can start our therapy. Now in the goal setting, who decides the goal? So I want you to put it in the chat, like generally in your practice, who decides the goal? Might be in the next 3 months, what are the what is the development you are expecting in the child? What are the activities you are going to do with the child? What is the expectation at the end of 3 months? Okay, I get to see therapist. Okay. So let me go ahead with, so there are things like parent oriented and therapist, child and the parent, child interest, parents need, therapist helping with the same. So there's a lot of things. So let's go in depth. Do we really know parents' real concerns? So when I ask this, parents' real concerns, so when a family comes to us, we know that, okay, the parents are concerned about the child deficits. The parents are concerned about the child's diagnosis. The parents are concerned about the child's future. The parents are concerned about when will my child join into the neurotypical world. But are we really aware of parents' real concern? So when we look into us, most of us, or at least few of us in this group would be parents. Is our role really only parent? We are professional. We have our own problems in the professional field. Apart from parents, we are an individual. As a person, we might have our own internal conflicts. We are not just a parent. We are daughter-in-law. We are daughter to someone. We are wife to someone. We are a mother of another child. And in that relationship, we have a lot of concerns. As an individual or as a family, we have our own financial concerns, health concerns. So when we meet a parent, are we dealing only with the concerns about the child, or are we dealing with an individual who have different layers of concerns? When as a therapist or as a professional, if you ask us a question, why should I be bothered about it? Because we already saw that the parents' well-being matters. The parents, how they cope with their stress really matters in the child's improvement. So do we really know the parents' concern? That is very important. How much do we know about the family? So if we know about the family, we can set our goals better. The next one is, what are the unique strengths and interests of the family? So when it comes to, every family have their unique strength. For some family, the strength is their extended family. For some family, that itself can be the deficit. For some family, the strength is like the knowledge of the mother or the knowledge of the father. For some family, that itself can be the deficit. For some family, the mother can be a dancer. The mother can be an architect. The mother can be school teacher, which is serving as a strength to the child. For some family, mother is a homemaker who has a lot of time to contribute to the child. For some family, it is a single child, so the parents can provide all their resources to this child. For some family, it is like there is a sibling who is contributing to the play skills of the child. So every family have their own unique strengths, and every family have their interest. So if I can remember, see, all throughout, like in my initial phase of my career, I met a family from Erode, a small town in Tamil Nadu. The mother came with a 10-year-old child in autism spectrum. So he's a boy, 10-year-old. Mother works in Shakti Masala company. So she tries to, she's a part of a women group. She goes there and pack the packets and seal the packet. So he's a boy, 10-year-old boy who's functioning as like a 2-year-old child. They don't have adequate therapy services there in Erode. But when I try to ask the mother, like, what is that you want for the child? Her only thing was, ma'am, can you train my child in toilet training? And he was entering into adolescence. He was fiddling with his genital. And her thing was, can you teach privacy to my child? And I was like, why only these two? Don't you want your child to communicate? Don't you want your child to learn skills like sorting, matching, academic skills? That was my question, because a doctor who is young into the field, I was like, what is this? She's only interested in this. Why no communication? Why no academic skills? The mother had a very clear cut plan. She had a very supportive extended family who helps in the self care of the child, and they are training him to be interdependent in his self care. Now her thing is like, my son comes with me to this women's group. He comes there, he sits there, and I am also training him to put the masala into the packet. I know for sure by 18 I can make my son work in the Shakti Masala company, but for that she needs toilet training and she needs that privacy, because she feels like, I'm okay if he does it at home, but if he does in this place, it's not hygiene. So I want that to be taught. So every family have their own unique interest, what they want to teach the child. Are we aware of that? Next one, please. Now, the next question is, when it comes to goal setting, does the family know what they want for their child? See, in your experience, you would have seen like we know that what the child needs. As an expert, yes, most of the therapists, we know to set the goals. But when it comes to the family, does all the family know? In your experience, you could have met some families who are very clear, like the example I stated. They know really clearly what they want for their child. Some family, they don't even know what they want for their child. Some family, if we ask this question, they might over expect. You might see a child of 3-year-old who is not even doing gestures, or you might see a 3-year-old who hasn't got a proper head control, but the family's expectation is, will my child walk? I want my child to talk. So that could be the goal from the family. As a professional, how are we going to deal with that? Next one, please. Hope is a very powerful emotion, and it should always be fostered. If we say to the family, like, oh, your son is 3-year-old and his functioning is like a not even 1-year-old child. Now you're saying like your son has to walk, your son has to talk. If I say this, I'm practical. But what I'm trying to do, I'm trying to shatter the hope. If the family is still not agreeing, I'm saying like, oh, you are in denial. You're not even agreeing. Might be the, if denial is one side of the coin, the other side of the coin is hope. Are we trying to shatter the hope, or are we trying to get the family in the same page of us and not being in denial? So we should be really aware of that while we are setting the goal. Next one, please. And while we are setting the goal, sometimes we might limit ourselves with whatever services we currently have. So instead of that, are we open enough that we are very open and we are discussing the goals? Might be think that a child is coming from a small town and there is no possibility of an inclusive school. We can provide the best of therapy services. Might be they are ready to come over here twice a week. But what is that we are going to provide for the school? If we are going to limit ourselves by the services which is not currently available and we are going to limit our goals, then that's not the fair thing we are doing for the child. So while setting the goals, are we aware of all these things? If we are aware of all these things, now is a goal being set only by us or by the family, or it's a together process? I want you people to ask this question. Next slide, please. Now, as a professional, we all know that when the goal is set, we are going to set in the zone of proximal development. We know that the child already has skills which are mastered. There are skills which are like far off from where the child's level is. So when we are selecting the goals, we are going to select from the zone of proximal development, where the child can be helped with the therapist, helped by the therapist by specific techniques, so that the child learns a skill. So while setting the goals, if the parent says that I want my child to talk, are we open enough to discuss that yes, talking is going to happen? As of now, it is out of reach. But prior to talking, the child should have gestural communication. The child should have a better understanding language. So I see that it is in the zone of proximal development. Do you agree? Can we start working on that? Is our discussion is towards the zone of proximal development? Next slide, please. Next slide, please.
Just a second, ma'am. The slides are not moving. Let me just reshare, please.
Yeah. So before the slide has been shared, now I'm going to ask you a certain question. What is the purpose? Now, I'm not going into the philosophy of what is the purpose of life. Now, the question I'm going to ask you is, what is the purpose of the milestone walking? Can you start putting in the chat? What is the purpose of a milestone walking? Why a child between 1 to 1.5 years should walk? What is the purpose of that walking? What do you think is the purpose of walking? Why should God or the nature give us a gift of walking by 1 to 1.5 years of life? What is the purpose of it? I don't see anything in the chat. To explore independently, to work with hands. Okay. To attain movement and purposeful function. Now, today, as an adult, if I ask you, did you walk? What would be your answer? As an adult, I'm asking you a question. Like, we met in the office. Hey, did you walk today? What would you say? Do you see walking as an exercise or walking as a daily walking? Yeah, most of us see walking as an exercise and fitness. If someone asks me, do you walk? If this question is asked to a child of 2.5 years old, the child would be wondering, hey, I'm walking. I walked and came near you. What is this? Did you walk today? I'm all the time walking. It's a normal thing to do. Walking is a normal thing to do. But if we ask the purpose of the milestone walking, we have a lot of purpose to it. Next, please. Now, in the same way, if I ask you, what is the purpose of going to school? Why did we go to school? Can you start sharing in the chat? Why did we all? Okay, we went for learning. Really? Did we do only learning there? Explore. Okay. Friends. Okay. Peer interaction. See, the purpose of going to school is one component is having multiple purpose. It can be for learning. Might be when I finish the school only I can go to college. If I go to college only I can go to work. It can be like, oh, I want to understand different aspects, different concepts. I learned the concepts. I figured out like what is my favorite interest is, and in that I started learning more. It could be like I went there to make friendships. Still, there are a lot of school friendship which we all cherish. So the purpose in one aspect is multiple also. Next one, please. What is the purpose of learning to read? We went to school, might be by third grade, we were all fluent readers. What is the purpose of learning to read? What do you think? What is the purpose of learning to read? Okay, later we can read to learn. Yes, because we learn to read. We did our 12th grade, we did our degrees. Most knowledge is in written form. Obviously, we should learn. It's communication, cognitive development. Might be learning to read is fun. It's not like all the time we read our books. We read novels. Learning to live is an important life skill. If you have to read science, we need to know learning to read. So again, learning to read has a purpose of fun too. So one component is what we think as life skill will also bring in fun. The last question in this is, next one, please. What is the purpose of job? We all work, right? Why are we working? What is the purpose of job? What do we tend to gain by going to job? Obviously, we are all paid, earn money for living. Might be we are engaging ourselves, the time meaningfully. Might be we are contributing to the society, contributing to the families we are connected with. We are giving back to the community. Sometimes the purpose of job can be challenging ourselves. See, it's like, it's not if we are going to be in one job, it is going to give us money, it is going to give us security, it is going to give us a position. After a certain point of time, the same job would be boring for us if you're not challenging ourselves. So as a human being, whatever we do, we have a purpose to it. And the purpose makes our life meaningful. If we don't have that purpose, and if one thing is not serving multiple purposes, it's not giving meaning to us. With this in place, let's go to the next slide. Now, as a therapist, as a multidisciplinary team, Apurva, next slide, please.
Yes, ma'am.
Yeah, it's like a lot of videos, it gets stuck. I'm sorry for that.
That's okay.
You can go out and come back.
Yeah.
So many of you would be aware of ICF model, F words. There could be few who are not aware of these F words. These F words are good F words. So are you aware of ICF F words? Yes. You want to share? What are those? F stands for? Oh, it's already, the slide is there. So Apurva, you can go ahead. So when it comes, initially, might be 10 years prior, we all worked on certain things. Now we are all working towards purpose. That is what, as a professional of multidisciplinary team contributing to children with special needs or adolescent with special needs, that's what we have changed. Earlier, we were working on body structure and functions. Now we are looking into the purpose. Why I am making someone improve in their body structure or improve in their function? Because everyone needs to stay fit and healthy, both physically and mentally. So is the purpose of movement, is the purpose of improving my core strength, is the purpose of improving my fine motor skills, is it something towards the fitness? And we teach different activities. Those activities could be like building up the cognitive skill of the child. It could be that we teach matching, sorting, visual sequencing, understanding, comprehension, all those activity. What is it leading on to? The child can do it differently, and how the child do it is not important, but is it contributing to the functioning of the child in daily life? If the child knows numbers, is it is becoming meaningful in the form of counting and taking vegetables? Is it becoming meaningful in the form of, if someone says 531 as a money, is a child able to type in the Google Pay thing like 531, 531? If the child knows to read, is it becoming in the form of the child is reading to enjoy, to have fun? If the child knows to match, does a child match his socks and takes correctly and wear? If the child knows sorting, is it becoming in the form of sorting vessels, sorting dress in the house? Is it becoming functioning? If it is just an activity, if it is not becoming the purpose functioning, then what are we trying to contribute to the child and the family? The next one is, we all know, like, all these skills which we teach the child should lead towards participation in the school, participation in the community, participation in the workplace. But is participation, why did we go to school? Why are we in the workplace? There we get a lot of friends. So the function of participation is friendship. And how a friendship should be? Who are we to judge? As a neurotypical, we think friendship is like sharing. Friendship is communicating. Friendship is common interest. Why can't friendship be just sit next to each other? That is also friendship. But are we making that opportunities to make friends? Now, when it comes to the personal factors, life for anyone is about having fun. Are we allowing the child to do activities which gives a real fun to the child? In child with autism spectrum, the child might like to do a lot of repetitive things. Are we seeing it as a repetitive behavior? Are we seeing it as a sensory issue? Or are we seeing it as child is finding the real fun and purpose with it? Are we allowing the child to do that in a safer way? Are we trying to build that into a real fun component? Sometimes it might not turn into a real fun component. Does a child have the safe space and a non-judging environment to do it? The next one is family. How do we look into the family? Are we looking into the family as you must contribute? It's your child. We are taking so much of effort. Are you contributing? Oh, you don't know much. You're overprotecting the child. Or you're not doing whatever we are trying to say to you. Why don't you contribute to the child? Are we judging them or are we respecting them? If all these 5 F's fall into the place, today, are we thinking about tomorrow, the future? Any child who comes to a special school or to a therapy center, are we thinking about the child's future? If we think about the child's future, sometimes we know like the child might not be completely ready for the society. Are we making the child's society, the near community, inclusive? So if our therapy services are going to be towards this 5 F's and the 6th F of making the community more inclusive, then we are really creating purpose for the child, for the family. And I think that brings in purpose to our work too. Next slide, please. Now, this is all in theory. How do you practically do it? Now, there is a family who comes to you, you have your goals in hand. Now you're asking the family like, okay, what do you hope for your child? What do you want for your child? Now the family doesn't know to say anything at all, or they say something which the child would be able to achieve 3 years down the line. Now, what is that which you can use to set the goals? So there is something called COPM, Canadian Occupational Performance Measure. There's a beautiful tool today I'm just going to go through it fast. I want each and every one of you to explore it and try to use it the way you want to use it. So the step one is you are trying to find out, you are discussing with the family. It's an open discussion where you are asking the family, what are the issues? Might be the family, if so, it's a child with autism spectrum disorder. The family can come up with, oh, my child doesn't make an eye contact. My child is not talking. My child is not playing properly. My child is not interacting with the friends. It could be a very gross thing. Now, you are going to go into each and every subheadings. There are 3 subheadings. One is self-care, productivity, and leisure. For any human being, these are the 3 things which is needed. One is like we should be able to take care of ourselves. When it comes to productivity, are we contributing to the family? Are we contributing to the society? And when it comes to leisure, any human, like we have like all work and no play makes John a dull boy. Everyone needs leisure. So these are the 3 important things for any human being. So with that in place, we are going to discuss when it comes to self-care. With regard to personal care, what do you want your child to do? So if it is a 3-year-old child, the parents can come with like, okay, with my support, my child should brush properly. If it's a 10-year-old child, it could be like, I want my child to brush independently. Then in children with cerebral palsy, the mobility can be a thing. Even with a child with intellectual disability or autism spectrum, a mobility could be like, I want my child to be aware of the traffic and walk in the road. I want my child to know to cross the road. So it could be that. Then community management. How will the child transport? How will the child go for shopping? How will the adult or adolescent manage his finance, money management? So with this in place, are we going to put the goals? And then we are going to ask the parents to rate the importance. If the adolescent is going to be a high functioning adolescent who can contribute, we can include that person also. With this in place, if we put the gross goals, then we can put to achieve that. For example, if I'm taking the goal like this 8-year-old boy has to go to a shop and pick up something. So what are the skills which I have to teach him? The skills could be like, okay, he has to precisely pick up things. While picking up, if he pushes all the other things, he won't be allowed to shop in the shop. The second thing could be like, oh, while shopping, if the child keeps the thing in mouth and bites an apple, a shopkeeper will not allow the child in the shop. Or the child needs to stand in a queue and pay. So waiting, it could be a skill which you need to teach. Or it could be communication to say like, I want this. Can you give me this? Communication. So if we have this in place and then we are going to put our goals, our minor goals, then it will become more purposeful. The next slide, please. So similarly, we are going to look into the productivity. Productivity, it could be like household chores. How much the child contributing to the family? For a 3-year-old, it could be as simple as after eating, can the child pick up the plate and put it in the sink? For a 10-year-old, it could be like, okay, while hanging the clothes, the child also hanging with the family. Now, when it comes to play and school, how much the child has independent, self-engaging play skills. See, as a therapist, we might teach a lot of play skills to the child, but always it would be with someone in place. Does a child know to engage himself or herself independently? And what is the academic capability of the child and how it can contribute to the work? And next, coming to leisure, how the child engages himself or herself quietly. See, for a 3-year-old, we say like, don't give screen time. But for a 10-year-old, that could be an important engaging thing. Is it allowed? It's not allowed. What is hobbies? The child might like to doodle, or it just happens as like the child likes to draw something or scribble something. Can it be converted into something like in the paint, with technology? Can we bring in graphic arts? So are we thinking in this line? If we are going to think in this line, and if the parents are going to put some importance to it, based on that, the most important goal, we are going to take it. It's not that we have to make all our goals like based on this. Can we pick up one important goal? Next slide, please. And put it. And currently, we are asking the parents, like, what is a performance level? Rate from 1 to 5. 1 means, okay, the performance is very poor. 5 means the performance is best. And satisfaction. Satisfaction is how the parents feel about it. For example, a child with an IDD or a adolescent with an IDD, the parent knows that always someone should be with my son or a daughter to cross the road. So the performance, what the child will be able to achieve is only 3. But the parents might feel satisfied for 5 because the adolescent is comfortable waiting and not running around, not hyperactive, not creating a havoc, not screaming in the road, but waiting patiently till they cross the road, holding hands and making sure walking safely in the road can give a satisfaction of 5. So it is not that always the best performance leads to best satisfaction. If the parents are aware of what accommodation has to be created, the performance can be 2 or 3, but the satisfaction can be 5. If so, today, this is a performance and satisfaction. When we are reassessing it after 3 months or after 6 months, that is a performance and satisfaction. So if we can use this tool, not just to provide therapy, but to provide purpose through the therapy, it would be a great contribution to the family. Next slide, please. Now, we know that we set the goals. Now, as a therapist, as a multidisciplinary team, we are working very hard with the child or the adolescent or the adult. Now, the question becomes like, see, I'm doing it for 45 minutes, two times a week, but you have to do it at home. And our expectation becomes like the mother or the father or the extended family should contribute to the therapy. Different preferences for being involved in the child's care is a parent's choice. Are we accepting it? Or if the parents are not contributing enough according to our standards, which we expect, are we judging them? Now, family members can participate in any roles. It can be an information provider. They comes and says like the child does it or doesn't do it. Is it still a deficit? If it's a deficit, please work on it. They can be that. They can be assistant. Like you say them something, they to a dot, they follow at home and they come and say like, ma'am, the child is able to achieve it. The child is not able to achieve it. Or they can be consultant. When I say consultant, it is like they are analyzing and they are saying like, okay, can you teach this skill also to my child? And they are figuring out multiple therapists who can contribute to the child. They are creating multiple support system for their child. They can play any role. It doesn't mean if one parent is playing an assistant or a consultant role is a best parent. A parent who just serves as an information provider is a worst parent. It's not that. We are going to respect these differences, and every parent has their own limitations. It's not that they are not hoping the best for the child. They might have their own limitations because they have multiple roles to play. Next slide, please. Now, if so, we want the parent to take the role of an assistant or the consultant. Now, we as a therapist want to teach something to the parent. Does all the parent have an inherent interactive style of interacting with the child, like what we think to be best, or it has to be taught? Can they learn over time? If they are learning, can they have their own pace of learning, or they should learn in the pace what we expect? Next slide, please. So generally think like with respect to early intervention, I'm talking. So when it comes to the parent interaction with the child, there can be 2 types of parent, a parent who is interactive, a parent who is directive. Directive means always giving orders to the child. Do this, do that, do this, do that, say bye. The time we say bye, the parent is already prompting the child, say bye to auntie. As I entering in, say good morning to auntie. By the time the child remove the bag and keep, the parent is saying, remove the bag and keep, put slippers in its place. It could be that. Or they can be an interactive parent. When they come to an interactive parent, we have 2 parameters. One is responsiveness and another one is achievement orientation. So we are just going to go into details of it. I'm not aware of the time. What's the time now? How long I have?
It's 7:45.
Okay. I think I'm in time. By 8:10, I will finish it off. Okay.
Yes, that should be good.
By 8 o'clock, please remind me so that the last 10 minutes I can rush it through. Hopefully, I'm not rushing it through.
Okay.
So the next slide, please. So when I mean what I mean by responsive child oriented behaviors, like how the parent be responsive to the child. There are three parameters. So we want the parents to be sensitive, or you can, as a therapist, if you're a young therapist, you can learn these things. As a professional, we have to be sensitive to the child. What is sensitivity? The parent or the professional seems aware of and understands the child's play activity or interest. If the child is engaging in the particular activity, are we allowing the child? Are we allowing the child to lead us and we are following the child? And we are helpful to the child's needs. Not saying like, oh, this is the best way. You have to put the rings into the stick. That's how I want you to do. That's when you will learn the skill. Or are we sensitive to child's need? Might be the child wants to feel it. Might be the child has a fine motor deficit, so the child can only remove it, or the child can only pour it down. So are we sensitive to the child's needs, child's interest? Once we are sensitive, are we responsive? What does responsiveness means? Are we supportive, and our responses to the child intentions, actions and requests are synchronous? That means, like, we are having a watch on what the child is doing. Are we doing a language modeling, like, oh, you are touching this, removing, like that? Are we monitoring what the child is doing, and are we talking about it? Are we adjusting our own responses based on the child's? Might be the child is looking for a block. Are we picking up and giving? Are we helpful to the child? That we call it as responsivity. Now we are sensitive, we are responsive. Next come effectiveness. If we are very effective, then we can easily join in with the child. So it's the ability of a parent or a professional to engage the child in the interaction. So any child whose developmental level is less than 2 years of age, the lot of effectiveness which should come from the professional and parent side to make the interaction going. So how is a parent in gaining the child's attention? How animated they are? How good they are in gaining cooperation? How good they are in gaining participation? How are they modifying the environment? How are they decreasing the distraction? How are they helping the child in turn taking? How are they modeling the simple games? Now, these three characteristics, if it is effectively present, then the parent can engage the child in the interaction, and the bonding between the parent and the child improves, so that the child doesn't feel like, oh, all the time someone is ordering me, or all the time this professional is ordering me. Rather than that, there is a beautiful bonding which is created between the parent and the child, or the professional and the child. Next slide, please. So we are going to look into the videos. These videos are not to judge anyone. Every parent have interacted with the child with the best intention. So we are just going to look at the video and we are going to see, like, okay, is the interaction directive or is the interaction interactive? If it is interactive, what do we find to be interactive? So we are going to see the first video. Post that, you are going to comment on it. Apurva, you can play the video.
All okay, Apurva?
Yes, ma'am. I'm just sharing the video.
Yeah.
Are you able to see?
You have to make the screen big, Apurva. It's small down.
Right. Thank you. Yeah.
with him. Very good, very good. Stick. No, no, no. No, no, no. Blue rings. Blue rings. Very good, very good. White rings. अच्छा red rings.
Pink.
Pink है था.
Orange.
White rings. Very good. No, no. No, no. এটা সুন্দর হবে না. Yellow rings. Yellow rings. Yellow rings. ছোট বড় সব মিলেছে. Green rings. John. No, no, no. Now, আসবে না, ঠিক আছে? ছোট বড় লাগছে না? Green rings. আসবে না.
Apurva, you can stop it. Okay, I want you to put in the chat, like, what do you think about the interaction? It's not to judge, it's just we are commenting on it. What do you think about the interaction? So we discussed 3 things like sensitivity, responsivity. So what do you think about the sensitivity and the responsivity? So, okay, I don't. Okay, let's play the next. Less sensitivity. Okay. Okay, Apurva, you can play the second video. I want you to see this video also and compare.
Look, wait, 1, 2. ಹತ್ತು ಬಿಟ್ಟು ಇಲ್ಲೊಳಿದು ಹೆಂಗೆ ಬಿಚ್ಚಿ ಕೊಡ್ಬಿಡ್ತೀನಿ ತೋ 1, 2, 3. Blue. Ladubba. Lamdo. Baile. ಎಲ್ಲಿ ಕಾರು ಹೌದು ಕಾರು ಹೆಂಗದು ಕಾರು ಡುರ್.
Okay, so now I want you to comment on this video. So as you people are commenting, I'm just going to compare these 2 videos. In the first video, with all good intention, the mother was trying to teach the child how to put the rings. She was saying like, no, put this yellow ring, put this red ring and all that. And you could see like the eye contact or the interaction between the child and the parent was less, but she was really trying to teach the child. In the second video, the child was allowed to explore. There is teaching. The father was trying to teach 1, 2, 3. He was trying to teach how to stack it. There was an interaction of the child was trying to communicate. He said car. He was trying to babble. So there is more engagement in the second video. There's a lot of responsiveness. The child is making some babbling sounds. The father is trying to repeat. And in there, something like a word approximation, like karu came and he said, like, yes, it's car. He was trying to talk about that. So there is a good responsiveness from the father, good sensitivity, and there was a to and fro interaction. Next slide, please.
Next video you want, ma'am? There's one more video.
No, not next video. Next slide.
Okay.
So when it comes to the initial, in the early intervention, what is more important as a professional or when you are trying to teach the parents, it's not the skills what we are trying to look at. We are trying to look at like, how is a bonding? Is a to and fro flow of interaction happening? So in a child in autism spectrum disorder or in a child with intellectual disability, to get this to and fro interaction is difficult. With a child in Down syndrome, this social aspect is better, but still, if we can increase this to and fro interaction, obviously the learning increases. The next comes this achievement orientation. In achievement orientation, here only we are trying to teach the skill to the child. Parents' encouragement of language and cognitive achievement through play, requesting, or appropriate prompting, where we are trying to teach the child certain skills. Now the bonding has formed. The child is want to engage with me. Now I am teaching it by scaffolding. The next zone of proximal development, whatever the goal is, I'm trying to teach. I'm not saying like you do it yourself, but I'm trying to scaffold it by prompting. And if the child does it, I'm reinforcing the child. It could be a verbal prize, it could be a tangible incidental reinforcer. For here, what the child got was like he was trying to play with the car. The father said, "Drr, karu." He was trying to give that car itself as a reinforcer, so that the child's interaction and compliance to learning is being appreciated. So by this method, in responsive interactive teaching, learning happens. Learning happens in a fun way. In directive teaching, it is not a wrong way of teaching. There also learning happens, but there isn't any to and fro interaction. There isn't any enjoyment. In a long term, you can't maintain the motivation. Next slide, please. So there's going to be another video. So I want you to look into the component of how the achievement and how the reinforcement is being introduced to the child.
Berry, de. I, berry, de.
कसा वाटतं तिला मॉडेल करणं? कसा वाटतं? गोड वाटतं? कसं वाटतं?
Sweet, sweet. Sweet, sweet. I, berry, de. Sweet, sweet.
नुसतं एक वर्ड वापर.
Sweet.
यमी. अच्छा ठीक आहे पण.
Yummy. I, berry, de. Masta, masta.
मस्त मस्त.
Ira is happy, huh? Ira is Guli, guli. Tata. Berry.
आई दादा ने.
So in this video, if you look into it, the mom is creating intention for communication for the child. She is holding the cup up. Every time she is modeling, she's not forcing the child that you have to talk this moment. She's just modeling 1 or 2 times, and post that she's providing the child and she's trying to interact. At the end of this video, it's not that we have achieved something, but the child understood like, oh, communication is something, it's to and fro. I make a sound and I get something. So she said like da, da, da. So when we are trying to teach the child, are we forcing the child to learn, or are we allowing the child to learn in his or her own place? So if we can teach this to the parent, that's a great thing. And if they are willing to partner with us, then that's going to be the great thing. Some parents will not be in a position to learn it. They want to contribute, but might be they are not in a position to contribute because of other things. Are we going to judge them or are we going to understand them? Now, when it comes to zone of proximal development, as a professional, we set the goals based on zone of proximal development, and we also teach the parent to prompt. But are we guiding the parents to decrease a prompt so that the child becomes independent? That becomes important for us as a therapist. Or the parent observes our sessions and they learn like, okay, by prompting, I can make my child learn. As a professional, we know like how to decrease our prompt, but the parents, if they are not taught continuously at home, they are over prompting that the child is not going towards independence. So as a professional, are you teaching that to the parents? That's also is important. Next slide, please. Now, what is the change we are expecting in the child? Next slide, please. So the change is how attentive the child is becoming, how involved the child in any activity they are doing, how much they are cooperating, how much they are initiating in the form of non-verbal eye contact, smile, initiating in the form of communication, talking, initiating appropriate play, how is their social interaction, joint attention. If all these improves, these are the prerequisites for the cognitive development. If all these happens, obviously cognitive development will happen. Next slide, please. So in any development, the first one is emotional regulation. Is a child calm? So in the last video, we saw the mother is modeling, but the child is calm. She's not like crying that I badly need it. You're not giving me, you're forcing me to talk. It's not that. The child is calm. The child is connected and the child is in a ready space to learn. The next becomes like building engagement. Are we connecting with the child? Is a child co-participating in the activity? Then goes to the next stage of the child is trying to learn by taking the responsibility. The child is learning. Is the child ready for challenges? If we are decreasing the prompt, is the child ready to do? How is the engagement? We are not putting all the efforts to sustain the child's attention. Is a child providing engagement on his or her own? If all these things happens, communication naturally happen. Till then, we are doing language modeling. When all these happen, the communication in the form of non-verbal and verbal communication happens. When all the four happens, automatically independence in the form of problem solving, dynamic thinking, all that will happen. Now, as a professional, we might know all these steps. As a parent, they might not be aware. Are we trying to have an open discussion with them to make them understand this? And both of the professional and the parent are in the same page to take the child towards independence. Next slide, please. So a very important component of the child-centered, family-focused therapy is parental well-being. Respect the family for their own style of coping without judging what is right and what is wrong. Some moms like to crib. They want to complain about everyone around them. They want to complain about their extended family members. So it doesn't mean that the other family members are not supportive. Might be that is her coping style. She wants to cry out. Her way of coping is just cribbing. That could be her coping style. So are we going to judge about like, oh my God, her mother-in-law is not so supportive, her husband is not supportive. The coping style of the parent is like detaching herself. She might be like contributing very well to the child and all of a sudden she becomes very silent, not contributing. Her coping style is, okay, I want to take my time off. I will recoup myself. Then again, I will start contributing. It can be any coping style. There's nothing called the best coping style. So are we okay with it? Next slide, please. And in any parental well-being, there isn't any one parent who is always at the best stage of well-being. As a human being, we all go through a cycle of well-being, and that holds true for a child, for a parent with a special needs child too. In the initial phase, once they have accepted the diagnosis and they are in action, they would be keen and committed. As they start working with the child, everyone wants some result or the other. If the result what they expect and the result what comes from the child is not matching, they becomes little irritable. They start becoming frustrated. They start saying like, okay, let me push myself hard. Though they are sad, they don't show their sadness. Though they are angry, they don't show their anger. They are just irritable. Then they go to a stage like, oh my God, I'm not able to take this child is not improving. I'm putting my best possible efforts. So the parents start asking themselves a question, am I not good enough? Is the therapist not good enough? Why is the other child improving? Why my child not improving? So they start becoming a little withdrawn because they are drained and they feel like whatever I do, improvement is not happening. They start avoiding their responsibility. After which, it can become two things. One is like they become exhausted and they become burdened and they say like somehow I have to do. So they start hitting the child, they start scolding the child, they start changing the therapist, or they can become renewed and resilient. The renewment or the resilience can come from us as a professional. Are we trying to encourage the family that they are doing the best possible efforts? What are the minuscule improvement the child is showing and how much we are happy about it? Are we sharing? Are we having the to and fro communication? Are we always encouraging the mom and appreciating the mom or the dad for their efforts, not for the result? Are we making the family look at the efforts, not for the result? Then the renewment and the resilience will happen. And again, they will be keen and committed. So this is a cycle. So as a professional, you will also go through it. You will feel like, oh my God, the child started improving. Now he's plateauing. Oh my God, this child is not improving. It's a cycle. So the well-being is not like we won't fall at all. The well-being is how resilient we are. So in the process, how much we are not judging the family and how much we are supportive for the efforts put by the family is what matters. Next slide, please. And the very important question is, should we do all the work as a professional, as a doctor? Should we do all the work, or is it something else? Someone else will do the work for us too. So how about a parent-parent partnership? So encourage parent-parent partnership. It could be an informal relationship, like if you're waiting for the therapy services, automatically, informally, two parents are talking. Or it could be specific programs that you conduct as a professional, a skill building program, or it could be like well-being program. Come, let's talk together. Let's talk our thing. There might be some family who has improved. There might be some family who is like still not improving enough. There might be co-parents who is at the same level. Or there could be some parent groups where we can give the numbers of the parent groups to interact with each other. Because if there's going to be an older parent who has gone through this, it is easy for the parent to understand, like, yes, I have been in this position. Few years back, I have been in this position. Don't worry, your child will improve. See, we are in a better position. Obviously, you will be in a better position. So that is something a parents can get to achieve through a parent-parent partnership. Are we encouraging this parent-parent partnership? When we do this, automatically some part of the work of some part of parent well-being is being taken care of. Next slide, please. So a very important thing is sibling. There might be an older child or an younger child in the family who is a part of this family unit. And how is this sibling being supported? For a parent, the responsibility of handling a special child comes after they form their own identity. Might be at 25, 30, we become parents and we take up this responsibility and we go through our own emotions of denial, our own struggle of acceptance, our own struggle of balancing. But consider a sibling who is with this child. There's no other choice. The sibling came into this family or was already there into the family. Now, the sibling has to take care or has to co-share the space with this child. They might feel abandoned at some time. They might feel that I'm over accommodating, or they might feel that I don't get the time from the parent as much as I can, or the child can feel like, oh my God, my sister or brother is going there and having lots of fun with lots of toys. Why am I going to the school and I'm sitting with notebook and pencil? It could be like the friends are giving some look. The child is going with a mall or a cinema theater. The other child is like showing a behavior. There's a lot of looks which is coming from. Can the child share his or her true feeling? Like, I don't want the sibling at home. I should have a normal sister or a brother. I want a normal sister or the brother who takes me, who comes with me to the birthday party and stays with me in my friend's birthday party. It could be that. Or an older child can become like over responsible, saying that, oh, it's not a deficit. It is a strength in its own. I'm proud of my sibling. When they get another emotion, a negative emotion, they can't even express. They think like, why I am thinking this way? I shouldn't think about this about my sibling. They start taking their professional decisions. There's a study which states that a sibling coming from a family of special needs, they take up medical professionals more. They are psychologists, or they are therapists, or they are into medical professional, or they are into finance profession more, so that they earn more money. So how much we are supporting the siblings? Are we making the parents aware that how much of struggle as a parent they are going through? A small child who is still not an adult is lifting the same weight. They are going through the same problem. Is there some services, can you make it available in your therapy setting? It's not like a structured thing. Come play in our therapy setting for the sibling on a weekend and share your emotion. Be open. Your parents are not there. If you want to crib about your sibling, crib. If you want to talk something proud about your sibling, talk. If you're worried about something, talk. So are we creating that safe space for the sibling? If we can do that, then we are all doing the best job. So now I'm asking the question again, whom are we offering our services to? To the family, with the child, or to the child? And who is taking the decision? Is we experts, whom we consider ourselves to be experts, we are taking the decisions for the family, or the family who knows about the child takes, or we are taking the decision together? If we are clear about these two questions, then our actions will be really clear towards a purpose, not just for the purpose of an activity, but towards the purpose of creating purpose in the child's life and in the family. Thank you. So I'm open for questions now.
Thank you, ma'am. That was really eye-opening. We do have some questions that had come into our system when people registered. So I'm going to start with that. And then my colleague Mabel will take up the questions that are there on YouTube and Zoom.
Okay.
We have one question here from Suguna. Please give us valuable advice to handle a child with autism spectrum disorder.
I think some of the videos which I showed is more of autism spectrum disorder. So rather than a directive teaching, if it's going to be a responsive, interactive teaching, it's very valuable for a child with autism spectrum disorder. And how much we are going to accept the child's sensory issues and accommodate the environment, how much we are going to shape the child's repetitive behavior into an appropriate play skills, if possible. That is what we can make a difference in the child's life.
So there's a question from Radha. Has there been any specific observation in terms of disability in adopted children?
See, now when we call disability in adopted children, most of the adopted children in their initial phase, in their home, in the foster care homes, they are trying to stimulate as much as possible, but it is not like optimal stimulation. So there would be a deviation in their development. So if the child is going to be adopted, are the parents really counsel that from the beginning, can they meet a developmental pediatrician, or can they meet a professional who will guide the family in facilitating the development? And if by chance, if there's going to be any deviation, are we starting the facilitation and the therapy services earlier? Actually speaking, is it a developmental delay or a developmental deviation? Mostly it is developmental deviation. If not addressed properly, it can go to developmental delay also.
There's one more question. How to plan and provide parent-based intervention? For how many sessions per month can we provide intervention along with parents? This is a question by Milu.
Okay, if it is a parent-based intervention, see, every therapist have their own comfort. For some therapists, parents sitting all throughout the sessions is comfortable. For some therapists, it's not the comfort. It could be like the child is not bonding with the therapist all the time. The child is going to the parent. Then it is like you decide like, okay, the parents can sit outside. If you can engage the parent in goal setting, that's wonderful. And after that, while you're doing the sessions, how much of parental training you're providing. It's not that your 45-minute session for 3 days a week is going to help. It is also how much the parents are trained. So how are you planning for the training sessions of the parents? Is it going to be an individual sessions, or every session 15 minutes you are going to allocate for that? And how are you and the parent are going to be in the same page? If the parent is all throughout in the session and you are able to maintain the child's engagement with you very well, well and good. If not, if the parent is going to wait outside, is it like every 15 days or every month, the parent sitting in and getting to know, like, okay, this is our goal, this is the direction we are going, we are moving towards the goal. That thing you are going to decide. So these are the 3 parameters. One is goal setting, parental training, so that they know like how are those activities are done at home. In a way, it improves the functioning of the child. It need not be the same matching and sorting. It can be like, can the child pick up his own 2 shoes? Can the child pick up 2 matching socks? Can the child sort the spoons and the cups? It can be anything, but it is moving towards functioning. The third thing is, are the parents and the professional are in the same page, understanding the goals, how are they achieving? So a COPM tool, if you can use it, it would be great.
The next question is by Nosheen. How to improve acceptance in parents?
Okay. To improve acceptance in parents, the one thing is, as a human, how much acceptance we have in us, how much we understand the parent, not just as a parent, as an individual with multiple dimensions to them. How much open are we to listen to them, to understand their different layers, and without judging how much we are providing. Acceptance is a journey. For any parent, acceptance is a journey. And the therapist or whoever is with the parent in the journey should also have acceptance in accepting the child and in accepting the parent. As a professional, we are all great in accepting the child. Are we great in accepting the parent? That question we should ask us. Very practical thing is, can we give some materials for the parents to know about the disorder better? Can we train the parent to know like how they can contribute to the child at home? Sometimes a helplessness comes in the form of like cribbing, comes in the form of like denial and all that. Are we empowering the parents with information? Are we empowering the parents with techniques to interact with the child? If possible, if the extended family, can we call them off into our sessions and let them also observe so that they understand it better? So these are some of the practical things we can do.
The next question is again about training families. Melita is asking how to train families with limited resources.
See, with limited resources, it's basically you are providing the sessions, right? So in your sessions, if it is possible that the parent is sitting inside and observing it, last 15 minutes, you are just training the parents to do it. So for that, it is the same therapy charges they are going to pay. So the limited resources is more than enough. If it is stacking, you don't have to ask them to buy all the toys. You can say like, okay, why can't you stack the cups? If it is matching, make it more functional. Or in your therapy services, if you have a thing of lending toys, like you take this home, practice at home, and then bring it back during the next therapy sessions. If it can be done, that would be great. So ultimately, if it is limited resources, how much good you are in parental training, that makes a difference.
Hajisha wants to know what therapies can we do with children who have intellectual disabilities? Can behavior therapy be done and how?
See, if it is intellectual disability, in assessment, you get to know, is it a communication delay? If there's going to be a communication delay, obviously there's going to be a speech therapy. In intellectual delay, they can have fine motor issues. They can, so if that's so, or if it is a thing of daily living skills, occupational therapy is going to help. Intellectual disability can be associated with a genetic disorder, then the core tone might be low, then physiotherapy come into play. If it is a cognitive, obviously intellectual disability is associated with cognitive thing. So obviously a special educator's role is very important. So a behavior therapist, see, in behavior therapist, whom do you mean by behavior therapist? I don't know. If it is behavior therapist, by definition, it is a ABA professional. An ABA professional is a psychologist who have done a behavior training, BCBA or BCABA. They are also going to address the cognition and the language skills. And any special educator or any speech therapist is trained in handling the behaviors also. So if it is going to be behavior therapist, if you are meaning ABA professional, yes. If you're going to ABA professional, it's good. If it is going to be behaviors for addressing the behaviors, any therapist who is good in analyzing why the behavior is happening. What is the antecedent? Behavior is a form of communication. For what is a behavior happening? What is the actual consequences? Can we change the consequence or can we change the antecedent so that the behavior doesn't occur? So, hope I answered the question.
Lavanya wants to know how to identify challenges in children. If I'm understanding it correctly, I think it's red flags.
Okay. So, if it is red flags, if you Google, you get a lot of red flags. Do you want me to say the red flags? So, or how should I answer this question? You want me to describe all the red flags? Do we have time?
We do not have time, but Lavanya, are you there in the audience? Can you please clarify? Otherwise, I'll move to the next question.
Yes,
Can you please elaborate your question?
ma'am, because I am seeing lots of sleepy children, but most of them, what the parents, it's just what
Lavanya, your voice is breaking.
for the it deficit to me. Okay, okay, ma'am. Now, ma'am, now is it okay?
Yeah,
Ma'am?
now it's clear. Now it's clear. Can you repeat your question? Or in the chat, you have written how to encourage equal.
That's what, ma'am. There is most of the time mother.
Okay, if that's a question.
Yes, ma'am. Because I will be counseling the.
Okay, I get your question. I read your question too. Okay, let me go into the answer. See, I want you to think from this perspective. It's your choice to think from this perspective. Now, if you look into the therapy services, any therapy services involves cost. In India, insurance is not providing, no one is sponsoring us. So the family has to do it. The mother is accompanying the child. So obviously the father is not sitting at home, he is working. He has to earn money. It's an extra money. Per month, at least minimum 10,000, they are spending extra. The father has to go and work. So then only money will come to the family. The father is not enjoying his life in the office. He's working to bring the money to the family. Now, when it comes to contribution, is the father not contributing? No, he's contributing through money. How is the mother contributing? The mother is contributing through her time and efforts. But does it mean that the father should not contribute? Yes, on a weekend, he can contribute so that the mother gets some time. So is the family ready for it? Are we open? Are we looking from a perspective like the father is already contributing? Can he contribute more? The mother is contributing. Can she get some rest? If the discussion happens in this way, then I think fathers are ready to come for the conversation. Otherwise, he is already listening at home, like, I'm doing all the things. I'm taking the child to therapy. I'm working a child at home. You're not doing anything. It's not that he's not doing anything. So this is my perspective about fathers. But if it is going to be like, you feel like really the father is not contributing, then can we have an open conversation? Might be the father is not contributing because the mother is all the time with the child. She's coming to the therapy. She has learned the skill. The father is helpless that he has not learned the skill to interact with the child. Can we teach those skills to the father? Does he have time to come, or can it be an online session where you are teaching it rather than the mother teaching the father? Because there's going to be that family dynamics, husband and wife dynamics, where the husband feels like, oh, she is bossing me, rather than that. If as professionals, if we are teaching the father, it would be great. If he can make a time, whether it could be an online thing where you're teaching the techniques to interact, will it be better? So when it comes to equal participation, I would think in form of equity rather than equality. the father is already contributing in the form of money. So the equity is the time and the efforts he can put. Might be 20%, the mother has to put 80%. If the mother is also working, then the equity changes.
Yes, ma'am, I got it.
Moving on to the next question. Sharvari wants to know how to bring harmony, cooperativeness, and helpfulness among family members, especially when there is a special child. How to keep family members in sync and resolve individual differences.
See, in any family, there is going to be disharmony because we are all different human beings with different characters, different needs, different preferences. Now, when there's going to be a special need child, there is a lot more brunt on put on the parents for resources, financial thing, and also like time, effort, and all that. How much the family getting to understand each other and appreciating each and everyone's contribution. It could be an open talk between the family members with the therapist, where each one of us are acknowledging ourselves for the efforts we put, not for the result. The efforts we put. The father can talk about the efforts he put by bringing in money or giving time for the wife to take rest for some time on the weekend. He might not be good enough to engage the child meaningfully in toy. Might be he just takes the child out for a bike ride. But is a bike ride considered meaningful by the mother? Oh my God, the child can be involved in some play activity. How does a mother sees this? And how does a father acknowledge the mother? They acknowledge and appreciate each other. So if acknowledgement is there for self, acknowledgement is there for others, appreciating the efforts of each and everyone, but not the result. Sometimes in special needs family, efforts is more, the results is less. But are we able to appreciate the minuscule improvements? And the third thing is everyone getting their individual time? See, it is not that all the time you can be parent. You need to be an individual. For example, Sharvari has to be Sharvari. Not Sharvari all the time can be a wife, can be a mother. Is Sharvari getting a time to be an individual person, Sharvari? Is she getting help from other family members for that? Second, Sharvari has to be a wife to mother children. So does a couple get their time? Is extended family members or friends helping that? Are we asking for help aloud? If we ask for help aloud, only people can help us. Are we open enough to ask for help? See, we need extra help. You can ask all the neurotypical families openly, like, we need help. Can you take care of a child for some 30 minutes? Take him to this park, he can engage, or give some screen time, he would be fine. As a couple, we need time. And if you have another child, is that child getting an individual time? Most of the time, the sibling gets homework time from the mother, not that individual quality time from the mother or the father. So how are we managing our time? If all this are addressed properly, then the harmony in the family is always there. So for a special needs family, even if it's a neurotypical or the special needs family, it's the same recipe. Might be here the struggle is more because there is more efforts, less result. Hope I answered that question.
Yes, ma'am. Thank you for that. Over to Mabel.
Good evening, ma'am. Ma'am, there's a question that says, sorry, I've lost the question. Ma'am, what could be the difficulties and level of effectiveness of parent-based intervention for the special child with both of the parents working?
See, even if it is a parent-based interaction, we should understand it's not like 24 hours someone is going to work with the child. In a parent-based intervention, obviously, a parent is going to work maximum a quality time of 2 to 3 hours. So if it is a quality time of 2 to 3 hours per day by the family, if both the parents are working, can the mother start her work late by 11 o'clock so that she contributes in her daily routines like bathing, feeding the child? Can she can bring in a lot of language modeling, a lot of communication bits so that she teach communication and a quality time of 1 hour. can the father come home evening fast earlier and engage the child? In between, the child might be going to a therapy center. The maid can take, if they have a caretaker who will take the child to the therapy services, a notebook can be given, or now we all have WhatsApp, might be WhatsApp voice messages shared to the parent, like this is worked, and so that every week or every 15 days the parents meet. Or if the grandparents are there, the grandparents are taking the child, then the child is brought in, and uh, the the child is put to sleep, nap time and all that, and evening the father comes and takes over. And if so, in the night, 1 hour as a family together, they can do some fun things like singing a rhymes and dancing to the rhymes, or they just go out to the park. So it's just a matter of 3 hours. How are we going to handle our time? The time management works. So it's not a big thing. Parent based intervention is not a big thing. It is all in the daily routines, how much we are going to be more effective and how much we are going to train the parents to be more effective. That's what is matters. It's not time, effectiveness of using those time. Hope I answered that question. Any other questions?
If
Ma'am,
you're yeah.
we're actually it's 8:30. Do you mind answering 2 more questions? If that's okay with you?
Yeah, it's fine with me.
Okay. So we have a question from Savita ma'am. How to include and motivate grandparents?
See, with regard to grandparents, there is something called, there are some grandparents who feel like, I have already parented. I know parenting. You don't come and teach me parenting. There are some grandparents who are like, oh my God, they are doing so many things. Is a child really having fun? I want to be that fun providing grandparent to the child. They, even in neurotypical, there are some grandparents who doesn't want to engage in really in the child's development, but they want to be that fun provider. They just want to be providing that safe place. So how the parents have a choice to take their role, like in my presentation I said, like, we are not going to judge the parents, we are not going to judge the grandparents also, but always there is going to be a mother-in-law daughter-in-law thing. It is not only in special needs family, in any family, where if the mother is doing a lot, she expects, like, why can't my parents or my in-laws contribute more? But if we can have a common discussion, if a therapist can do it, and what is that the grandparents want to be? Do they feel like already they know parenting? Okay, they can do in their own way. It is not that what the therapists say or what is the best way, they need not do. They can do in their own way. Any stimulation is going to help the child. It is not that the stimulation in the form of, like, okay, you do language modeling, you teach the play this way, they have to play with this toy. No, taking a child to a temple is also some learning. How to walk in the road, holding in hands, in the temple, not running around. While eating prasada, how the child has a lot of sensory things. Without spilling, how can the child eat? There's a lot of social interaction, saying hi. Many things is happening in a daily life interaction. The parenting can happen, or the grandparenting can happen, a visit to a temple also. What is the expectation from the mother or the daughter-in-law and or the daughter from the grandparents? Are we clear about that? So it's for human, any problem can be solved by communication. Is everyone given a space to share what they really want to contribute? Do they want to contribute, or what contribution they want to provide? It could be like helplessness, or it's all like modern things they are doing. I don't know all these things. I'm not sure whether I can learn all these things to contribute. It can come from fear also. Then it could be like the grandparent could be someone who cooks all the nice dishes and allow the child to enjoy the food. That is also grandparenting. So the contribution can be in multiple ways. In any way they contribute, is the parents open enough to acknowledge it and appreciate it? or sometimes the grandparents can be a hindrance to therapy. They might say like, oh my god, these people are saying a lot of things, they might be in denial, they might not agree. If so, we can call them and we can really explain to them or show them like what is the deficit. We can acknowledge the strengths whatever they are saying about the child, but we can also make them see like what are the deficits in the child. For them also it's a journey. Ultimately, who are the decision makers? Parents are the decision makers. Grandparents, over time, they will understand, they will accept, they will contribute. Hope I answered your question, Savita ma'am.
Thank you, ma'am. I think those practical tips were really good. There's a last question by Anushri and Shilpika. Both want to know the importance of early intervention.
See, early intervention is very important. As early as possible, if we can find out the deficit without even giving a label, we can start the intervention. But we should also remember that the brain is always growing. Neuroplasticity is always there. Even an adult who had a stroke, if the physiotherapy and all that is given, neuroplasticity happens. But neuroplasticity is slow. Don't make the parents run a race. Somewhere I feel like, within 3 years, my child has to learn all the skill. If the child is not learning all the skill within 3 to 4 years, my God, my child's life is lost. It's not that. It's not a race to run. But starting the intervention without even a diagnosis, stimulating and facilitating the child's development, enriching the environment with right stimulation is the need of the hour. If the child has not achieved by 3 to 4 years of age, it's okay. There is a whole lifetime to learn. Can all the therapists in this place to acknowledge the parent for their efforts, what they have done. Sometimes we have overemphasized on this early intervention, neuroplasticity. By 4 years, the parents becomes like, oh my God, I have failed in my race. It's not that. After 4 years, there's a long time to achieve. We can still stimulate the child, still the child can learn. Might be the pace of learning is slow, but it's okay. Learning is a learning. Anything else?
So we'll stop with the questions, ma'am. Thank you for your patience and guidance. As always, you've been enlightening as always. I now want to invite Ms. Kritika to give the vote of thanks.
Good evening, everyone. On behalf of the Brave Child Trust, I would like to extend my heartfelt gratitude to our esteemed speaker, Dr. Kirtika. Your input has given us a wholesome understanding of our family and has helped us become more aware of the very realistic problems faced by families and their expectations, especially families of neurodivergent children. And it has helped us also understand ways which we can resolve them as therapists. Thank you, ma'am. A wide round of applause to Ms. Bindya for the lovely introduction to our speaker and getting the session started today. Ms. Apurva and Ms. Mabel for hosting the Q&A session and managing the technicalities. Dr. Gauri for hosting and organizing the event. And to our extended team who made the event a memorable one. Lastly, I would like to thank all the participants for making the time to be with us today and helping us make this event a grand success. Thank you, one and all.
And at the last, thank you, Kritika, for the vote of thanks. So thank you, everybody. When you are leaving, there's a very, very short survey. So kindly fill it in before you leave. Thank you, Dr. Kirtika. You've been, very easygoing and very easily accepted this invitation. Thank you so much. And now we will end the session.